Welcome to Module 4 of Suicide and Crisis Intervention Models. Today, we'll explore how to optimize the use of the CAMS model, the Collaborative Assessment and Management of Suicidality. As you've already learned, CAMS is a client-centered, evidence-based approach designed to assess and manage suicidal risk. It emphasizes collaboration between the clinician and the client to understand suicidal thoughts and behaviors. It aims to create a supportive environment where the client feels understood and engaged in their treatment. There are four crucial steps to effectively implement CAMS. First, develop organizational suicide-focused policies and procedures. Establish clear guidelines and protocols within your organization that focus specifically on suicide prevention and management. This ensures a consistent approach to handling suicidal clients. Next, identify suicidal thoughts early. Implement reliable methods to identify suicidal ideation as early as possible in the assessment process. Early identification is key to providing timely and effective intervention. Third, ensure access to professional consultation and supervision. Regularly consult with and seek supervision from experienced professionals. Do this even when you are an experienced professional. This not only supports your own confidence in managing suicidal clients, but it ensures that you're providing the best possible care, and it is protective from a liability perspective. Finally, create suicide-focused documentation. Good documentation reflects good practice. So says Jobs, and he's right. Documenting the assessment and treatment process thoroughly and accurately is essential for effective treatment, case management, and liability protection. It's vital not to reject, avoid, or shy away from patients with suicidal thoughts. Instead, become competent in treating them with appropriate supervision. Also, avoid relying on no harm contracts, as these do more harm than good. Instead, focus on collaboratively engaging with the client to reduce their suicidal thoughts and behaviors. This partnership is at the heart of CAMS and is essential to its success. The CAMS risk assessment is structured to ensure a comprehensive evaluation of the client's suicidal risk. The first session is divided into three sections. Section A, taking about 20 minutes, is the initial assessment to understand the client's current state and risk factors. Section B, taking about 10 minutes, is a further assessment to delve deeper into the client's thoughts and feelings. Section 3 is treatment planning to address the identified risks and begin creating a safety plan for the client. You'll read more about exactly how to complete the form in the Jobs text. When addressing suicide risk, it's important to listen for language that indicates despair and hopelessness. Address suicidal thoughts matter-of-factly, without judgment or avoidance. Introducing the suicide status form early in the process helps structure the conversation and ensures that all critical areas are covered. While doing this, it's essential to instill hope in the client, even while acknowledging their feelings of hopelessness. The SSF suicide status form is a pivotal part of the CAMS approach. It should be completed collaboratively with the client, whether in person or via telehealth. In an office setting, assist the client in filling out the form side by side. For telehealth settings, use screen sharing to complete the form together. This collaborative approach is critical. The suicide status form is not meant to be filled out by the clinician alone after the session. Instead, it's designed to be an interactive tool that engages the client actively in their treatment process. Optimizing CAMS and the CAMS risk assessment involves a structured, empathetic, and collaborative approach. By developing suicide-focused policies, identifying suicidal thoughts early, ensuring access to professional supervision and consultation, and maintaining thorough documentation, we can effectively support clients in crisis. Utilizing the SSF collaboratively with clients helps create a shared understanding and focus on reducing suicidal thoughts and behaviors, ultimately aims to save lives.